Thank you. All right, we're going to move on to Pat Frost. She is a vice chair of the National Pediatric Disaster Coalition. We're going to give you the mic here for 5 minutes. So I'm going to get out of the way here. Let me know if you want me to advance your slides.
Well, hopefully this will work. When I click on it, it doesn't seem to work. So I'm going to, there we go. So thanks so much for having us. We are a grassroots, highly networked organization that started in 2015 at the National Healthcare Coalition Conference. And our purpose is to connect novice to expert. And we've been actually working in the virtual space in order to connect communities across the country with resources that are readily available, but people just don't know that they're there. We have a who's who of executive committees who are experts in subject matter experts across the nation in pediatric disaster preparedness. Next slide, please. Okay, so our role in COVID ops is similar to when we hear of any particular event that has a national impact, is that we try to provide situation awareness. We have a listserv of over 500 people, and also are pretty active on Twitter and our social media, LinkedIn and Facebook, and make people aware of the just-in-time resources that they can implement right away in response. We also evaluate and promote cross-discipline pediatric just-in-time resources and inform. We are very active with both of ASPR's Pediatric Disaster Centers of Excellence, and many of our executive committee members are actually advisors. I am on the I'm the lead for the working group for the Eastern Great Lakes Pediatric Center of Disaster Excellence. And we're interested in gaining people from AHEP to participate in our program. One of the things that has really been wonderful is that there's been unprecedented just-in-time education. And what you probably have noticed is that everybody is making their information open source. This has never happened at this scale in the United States for any event or worldwide. You can jump on calls with international scientists. You can join groups to hear, you know, the greatest minds in the world talking about how they put together and they're approaching vaccine development. It is extraordinary, and I'm hoping that much of this is going to continue because we all benefit from information sharing. Next slide. So 3 lessons worth spreading nationally about children and disaster is that children are always disproportionately impacted. And with COVID, we're seeing declines in vaccination rates, health screening, school lunch programs, child care, education, mental health, increases in non-accidental trauma, and also adults being prioritized over children. If you probably have heard that most of the PICUs in the United States have had, in the high impact areas, have had to take adults in order to do the bed expansion that is necessary. And this can have unintended consequences, and there's so many unknowns that we still have to face here. In our approach is to really make sure that everybody knows that child disaster readiness is whole community readiness. And if you're, if you're preparing for children and their families, and that they have good resilience and they know what to do in a disaster, that helps prevent people unintentionally and children to falling into the med health system, and preserves assets. Pediatric Ready, we are really focused on building regional systems of care, just like you would be for STEMI or stroke or whatever, so that we can give the best possible care possible. Next slide. Next slide. Recent results, if you have one child who is admitted to your PEDS ICU, you can estimate that there are 2,381 children in your community that are COVID positive that you don't know about. So deploy detailed education on household infection control to parents and multi-generational families is our recommendation. Next slide. And also, you know, all of this going on in terms of disparities, I want to emphasize that children are at the forefront of these inequities. 1 in 6 children in the US live in poverty, and we know that poor outcomes happen in communities because of this statistics and the impact on families. Thank you.
Thank you so much, Pat. Believe it or not, Pat was specifically on the dot 5 minutes. Very impressive. Pat, we have a question from Kevin Arthur at Primary Children's in Utah. And is there a list of surprise findings or best practices for adult care in the PEDS facility?
Yes, actually, there is a very excellent resource, and there's a whole website and and that basically evolved just to address this issue. And the site is called Popcorn, and I'll try and find the link and put it in the chat box. You need to go there. These are the people who are doing this work. They have protocols, they have education, they have groups to webinars you can get on, and they are learning from the people who do this the best, and both on the national and international basis. I'll find the link and pop it into the chat.
Excellent. And Jen asked if there's any tips for turning PICUs into adult areas that you have specific.
Well, again, that's all part of that Popcorn initiative. So I would say that's the go-to place in order to get the information you need and get connected if you're finding yourself in that situation. So it's a great group, and we network with them highly.
Excellent. All right, I'm going to turn it over to Steve. Steve Ikuda is